Hi there. Welcome to another episode of Health Protocol. In today's episode, we're going to talk about the top 5 mistakes people make after a total knee replacement. You don't want to make mistakes. So, we're not talking about surgeon mistakes. We're talking about patient mistakes. Right. Okay, so, what's your number one? What's the number one mistake people make when they're getting a total knee replacement? Before we begin, if you like this video, please like it and subscribe to our channel. I think the number one mistake is not having a plan for after surgery. Okay, alright. So, you come in, you have your knee replacement, and then the discharge planner comes to talk to you, and you're like, well, I have no plan. A lot of times nowadays on day one, or in some hospitals even the same day, you're going home. You have no plan in place for how you're going to manage after this surgery. Okay, but the patient says, listen, I'm just going to go home and sit in bed. Why do I need a plan? You need a plan because you can't just sit in bed. You're going to have to get up and move around. How are you going to get your food? Is anyone going to be there helping you? Yep. How are you going to get to and fro because you can't drive right away? So, the plan needs to include who's going to be there to help you, where you're going to be, and how you'll get back and forth, or to and fro. We both think that's critical, and you need to do it ahead of time, sometimes weeks, or even months in advance. We have lots of older patients whose kids come in from out of town or whatever. Maybe you move in with someone for a week. Maybe you go to respite care. Lots of options. But you need to have them in place before you go home. Have a plan, okay? That's number one. Number two for me, and I see this all the time and it drives me crazy, is not taking enough pain medication. Right. You have to take pain medication, yes. As we've said in other videos and as your surgeon has certainly told you, you are going to have pain after your knee replacement. That's just the way it is. And we're sorry for that. Sorry, I forgot that. But it's true, it's a painful procedure. So, you have to have your pain medication on board, almost on a regular basis for the first while, for sure. And nowadays we are very, very sensitive, and accurately so, to the risks of narcotics. However, it is a critical and necessary part. Because what happens, Paul? People come in at 2 weeks and you've given them, say, 100 pills of something, and they should come back with 90. What do their leg and their performance usually look like when they haven't taken any pills? They've gone to physio, and they haven't been able to do their physio because they're in too much pain, right? And the pain meds don't necessarily have to be narcotics. There are also anti-inflammatories that are given. There's also acetaminophen that's often used. So there's a variety of pain medications. We often use a multimodal pain medication approach. Check out our video on multimodal pain medication. Yep, there is. It may include a topical. But whatever it is, you want to keep taking your pain medication regularly. And remember, we always say, it's easier to keep pain away than it is to get rid of pain once it comes, right? I think that's a very good point. It's like unwanted guests at your house. Lock the door before they come. It's easier to keep them away than to get rid of them once they're here. I think that's a very good point. And we've said this before as well. When you're taking narcotics or heavy-duty medication for an appropriate reason under supervision, the odds of acquiring or developing an addiction are very, very rare. So, it's all supervised and we are cognizant of that. So I think it's really important to make your goal to reduce your pain so you can get your range of motion. Because the same thing applies. If you get a stiff knee, it is very hard to get your knee unstiff or to loosen it up. We want to prevent the stiff knee, and the number one way to do that is by pain control. Yeah, that cycle is vicious. I've got a lot of pain. So I don't want to bend my knee because it hurts. Now my knee hurts because it's stiff, and I don't bend it, and I don't want to bend it because it hurts. It's a vicious cycle. So, you have to break that cycle, break that pain cycle so that you can, or in Australia, it's a vicious cycle. Yeah. Otherwise, right. For our viewers down south, depending on what side of the equator you're on, basically, you want to break that pain cycle so that you can achieve a good range of motion in your knee. Okay, that's two. What's number three? Number three is doing too much too soon after surgery. Okay, and that includes engaging in high-risk activity. Okay, I'm a week post-op. Seems like a good day to go out and shovel the snow. You might be able to do it. You might be strong enough, comfortable enough. However, your reaction time isn't going to be as good if you step on some ice. It doesn't have to be ice. It can be wet ground at home, around the shower, something like that. You engage in high-risk activity, where you're at risk for falling, or you're doing too much. You're feeling okay, so you're doing the stairs 50 times a day. Yep. So, is it possible to do too much? Yeah, it's possible to do too much in the first while, because those tissues that have undergone surgery have to heal. Yeah, and you want to push yourself for sure, but yes, if you get severe pain or severe swelling, or you get so sore that you feel unstable, because sometimes, as your muscles get tired or get sore, they're going to be unstable and could potentially cause you to fall. So yeah, if you're walking on a treadmill, we don't want you to set it to 7. We probably don't want you on the elliptical early on. We want to try to avoid things where you can fall in general. Yeah, because we want to give those soft tissues a chance to heal, and we don't want you to have a fall and fracture. You have to walk before you run. Okay, so that's 3. Number 4 is kind of the opposite of that, and for me, it's not doing prehab, or not doing enough before. So, doing too much after, and now, not doing enough before, right? Prehab. We've talked about prehab before. What is prehab? Prehab is hab, that you do pre. No, it's a Latin lesson. It's doing your physical therapy, starting your physical therapy, before you replace your knee. And we can say physiotherapy in Canada. In the States, I think they say it slightly differently. Not physiotherapy. Physical therapy. Physical therapy. Yeah, so one of the comments there is making fun of us a little bit. Yeah, thank you for educating us for your... So, prehab includes starting your physical therapy before the surgery, so that you're attuned to it when it comes time to do it after. And it's not a surprise. It's like studying for an exam. I like that. You don't want to be learning new stuff on the exam. I think the other reason, too, is because then you're stronger. You maybe have better range of motion, particularly for knees. And you might be stronger. Plus, you know what to expect. So, while you're suffering in pain, you're not trying to learn a new skill. Yeah, I think that's a great one. So, that's number 4. Number 5 for me, and this is a little tricky because everybody's lives are a little bit different, is going back to work too soon. Typically, we tell people 8 to 12 weeks, and often, I encourage people to take the full 12. Because you know what? You get one good crack at a joint replacement, and we want you to be as successful as possible. We recognize, however, that some people have to go back to work. Self-employed people don't have benefits that are going to pay them to be off work. So, we recognize that. And sometimes you can't control it, but if you can, in general, yeah, we want your job to be your joint replacement. That's right. I mean, you deserve a break, right? You've had bad arthritis in your knee for a long time. You've undergone surgery. Take a little break afterward and let yourself heal and recover. Yes, Brad's right. Sometimes people have to go to work right away. If you do, try and go back with light duties. Yes, try and modify your work. Modified hours, even modified hours. Yeah, you know what I mean? Do something where you're not going back full tilt too soon. Yeah, because for me, I want your new job to be your joint replacement. If you have a knee, your new job is your total knee. Yeah, that's your new favorite. That's it. That's your new job. Punch in on that clock. Okay, so let's review the top 5 mistakes or troubles people have after total joint replacement. You better go, because I forgot them already. Okay, so particularly total knee. You went back to work too soon. Back to work too soon. Didn't have a plan. Engaged in high-risk activity that puts you at risk for falling or fracture. Or doing too much, not letting the tissues heal. Didn't take enough pain medication. You've got to take enough pain medication. Number 5. Didn't do your prehab. That was it. Prehab. See, I forgot prehab already. All right, you've got to do it. You've got to study for that exam. Yes. So, please adhere to these sentiments and do them to increase your chances of success. And if you like this video, please like it and subscribe to our channel. And remember, you are in charge of your own health. We'll see you next time.